You trained for years to become a doctor, to help others, to challenge yourself, and to make a living. Now, a few years into practice, you're questioning if you made the wrong choice. For whatever reason, clinical care just isn't for you, and you're not sure where to turn. What if I told you that clinical care isn't the only way you can use your medical knowledge to support yourself or to help others? In fact, stepping beyond the bedside might be the key to rediscovering your passion without leaving healthcare behind or leaving all the knowledge and skills that you acquired behind. If you've ever felt burned out, stuck, or like medicine is draining the life out of you, then this video is going to open up doors you didn't even know existed. By the end, you'll have a clear roadmap of real, rewarding career options outside of clinical medicine and know exactly how to transition without losing your purpose. And trust me, I've been there, but more on that in a second. Imagine for a minute waking up without the stress of back-to-back patients, administrative headaches, or the never-ending battle with insurance companies. Picture yourself still using your medical expertise, but on your own terms, maybe in a different way. Maybe as a leader, an educator, an entrepreneur, or even a medical consultant, shaping the future of healthcare from a whole new perspective. You can have a fulfilling, high-impact career without sacrificing your well-being. And today, I'm going to show you exactly how. For those of you who don't know me, I'm Dr. Ben Ranking. I'm a pediatric cardiologist, academic, teacher, and physician coach. I worked with countless doctors struggling with career dissatisfaction, wondering if there's more to medicine than just seeing patients all day long. I've seen friends and colleagues, and myself, hit a wall in clinical practice. And for a long time, I thought stepping away from patient care meant giving up on my purpose, until I realized that medicine is so much bigger than the walls of a hospital. In reality, more and more physicians are feeling exhausted, burned out, and trapped. Studies show that nearly 50% of doctors experience burnout at some point in their careers. You worked too hard to hate your job. The hard truth is, if you don't take control of your career, you're risking waking up years later wondering why you stayed stuck for so long. Ready for some good news? Yes, you have options. There are non-clinical career paths that allow you to use your medical knowledge in impactful, meaningful ways without the constant stress and exhaustion of bedside medicine. If you love medicine, great, keep practicing. If you don't, then keep watching. Today, I'm going to break down the best non-clinical careers for you. First is medical writing and education. Doctors have a unique ability to translate complex medical topics into simple, understandable language. And guess what? That skill is in high demand. You can become a medical writer, create online courses, or work in academic medicine, helping educate the next generation of healthcare professionals. Some physicians are even making six figures writing medical content for top publications, universities, and online platforms. If you love teaching, this could be an amazing fit for you. Curious about your options? Go to any career website like Glassdoor and Indeed and search for medical writing jobs just to get an idea of what's out there. Next is healthcare consulting and industry leadership. Have you ever wondered how major hospitals, biotech companies, or pharmaceutical firms make decisions? They need experts, physicians like you, to guide them. Physicians who step into consulting roles help shape healthcare policies, improve hospital efficiency, and even work with medical startups. The best part, you're still impacting patient care just from a unique perspective. Next is entrepreneurship and startups. Some of the biggest innovations in healthcare come from doctors turned entrepreneurs. If you've ever had an idea for a better medical device, software, or health tech startup, this might be your path. Think about it. Who understands the problems in healthcare better than you? Starting your own business is challenging, but it's also one of the most rewarding ways to create real change while building financial freedom and having a little more flexibility in your life. Next is physician coaching and career mentorship. I'll be honest, when I first started coaching, I thought, who am I to help other doctors? But then I realized that ultimately, so many physicians struggle with the same career frustrations, and they need guidance from someone who's been there. Physician coaching is a growing field, whether you're helping doctors navigate career transitions, manage burnout, or develop leadership skills. There's a niche out there for you. Next is medical expert witness and legal consulting. This is kind of a fascinating one that many doctors don't realize how valuable their expertise is in the legal world. Attorneys need physicians to review cases, to testify in court, and provide expert opinions on medical legal issues. It's flexible, potentially lucrative, and a great way to stay connected to medicine without direct patient care. The biggest fear that doctors have about leaving clinical practice, feeling like they've wasted their degree or that they don't know where to turn. But here's the truth. Your medical training is never wasted. You have a valuable skill set. Everything you've learned, your ability to diagnose, solve problems, and think critically is valuable beyond the bedside. You just have to find the jobs and learn how to apply your skills differently. Success in medicine isn't about where you practice. It's about how you impact lives. If you're feeling stuck or drained by clinical medicine, you don't have to stay there. You have more options than you think. The difference between those who make a change and those who stay stuck is making a decision. You have to decide not to be stuck. So here's my challenge for you. Drop a comment below. Which of these careers excites you the most? Which scares you the most? And if you found this helpful, repost this video so more physicians can rediscover the opportunities they never knew they had. Your career should bring you joy, fulfillment, and balance. And if it's not, it's time to explore a new path. I'm Dr. Ben, and I'll see you in the next video.